For the knee to function properly, it's going to require multiple muscles and joints all being in their proper position. This requires the ankle and foot joints to keep upright, to keep that tibia in its position so that that knee can hinge. If they're not doing their job, the tibia starts to internally rotate or tip in. So you've seen people walk where that knee is really tipping and rocking. What that does is it twists the knee, causes internal stress and strain to the meniscus, those deep internal structures that stabilize and support the knee. As that turn and twist happens, we end up overwhelming many of those muscles, tendons, and ligaments, start damaging them, and over time we end up these chronic pain sources. Every time twisting goes through that knee, we send more pain signals up to the brain, causing more pain and also shutting off muscles. Over time, we end up with an imbalance. The quadricep muscles broken into 4 muscles. The inside one, the vastus medialis, needs to be balanced by the vastus lateralis, the outside one. Together, these 2 muscles are helping to control both knee flexion and extension, but also keep that knee patella tracking in its proper groove. When the vastus medialis isn't firing on time or isn't pulling hard enough to balance out the vastus lateralis, that kneecap starts shifting to the outside. That vastus lateralis is pulling it up and out, so that kneecap is grinding on top of the femur, giving us damage to both that cartilage of the patella and to the femur, leading to either chondromalacia patella or patellofemoral syndrome. Over time, the vastus lateralis becomes more and more dominant. It keeps pulling to the outside, and the vastus medialis continues to weaken. This is further complicated if we have hip weakness or dysfunction. If the hip isn't being stabilized, it ends up rocking that femur a little bit more, or the pelvis has a wobble in it when we walk. What that does is as that femur's tipping and rotating in, it's making that knee rotate even further, causing more stress and strain and more pain sources. So with knee treatment, what we're going to do is make sure the ankle, knee are in proper positions and stabilized. We'll probably have to balance out the vastus medialis to vastus lateralis, and we'll have to work on those hip stabilizers because they need to be strong and stabilized to keep the hip where it should be. When we do that, in combination of getting rid of all the pain sources around those muscles, tendons, and ligaments around the knee, we are able to walk further, squat like we haven't been able to in years, and all of our normal pain with daily activities disappear.